Welcome to Clinical Capsules from TRC Healthcare, your trusted source for practical, evidence-based updates. On this episode, Assistant Editor and Clinical Pharmacist Gina Corley shares how pharmacy teams can tackle the growing trend of vaping with practical strategies, treatment options, and counseling tips to help patients quit, in an excerpt from our popular Pharmacy Essential Updates webinar series. This podcast offers continuing education credit for pharmacists and pharmacy technicians. Please log into your Pharmacist Letter or Pharmacy Technician's Letter account and look for the title of this podcast in the list of available CE courses. None of the speakers have anything to disclose. Catch new episodes of Clinical Capsules every second and fourth Tuesday, bringing concise, actionable insights from TRC experts straight to your ears. With that, let's get started.
This is an important topic because, as our article states, adult vaping rates are on the rise. In fact, e-cig use in adults has increased by 2% in recent years, with people ages 21 through 24 having the highest usage rates. So as pharmacists and techs, we are in a prime position to talk to patients about the risks of vaping and help give them strategies to quit. But first, let's talk about some background info on e-cigs. E-cigs are commonly referred to as vapes or vape pens, so you may hear me use these terms interchangeably. Other names include tanks, pod mods, or dab pens. Most e-cigs contain nicotine, but some are nicotine-free, and others contain cannabis products. So when we talk to patients about vaping, it's important to ask them what they vape, since there are different options. Vape pens work by heating a liquid, commonly referred to as vape juice, to produce an aerosol for the user to inhale. A lot of companies make flavored vape juice. Common flavors include mango, menthol, and mint, but there are a ton to choose from. And this can be one of the reasons that many young people find vaping appealing. A lot of vape companies market their e-cigs as being safer than smoking. While it's true that e-cigarette aerosol doesn't contain all the harmful contaminants of tobacco smoke, e-cigs do contain harmful chemicals such as diacetyl, ethylene glycol, and formaldehyde. So although these products are arguably safer than smoking cigarettes, we still want to let patients know this does not mean they are safe or healthy to use. Some data suggests that e-cigarettes can help patients quit smoking, but other data show that e-cigs often lead to dual use, which is where patients smoke e-cigs and regular cigarettes. Plus, FDA recently authorized the marketing of tobacco and menthol-flavored Juul products, following an intensive scientific review that showed they may be effective in helping patients quit smoking. And this may lead to some patients believing these products are safe. So if patients ask about trying e-cigs for smoking cessation, we don't want to encourage their use, but we also don't want to stand in the way of a quit attempt, since e-cigs may be the lesser of two evils. But there are a couple unique barriers to vaping cessation to keep in mind. For example, most cigarettes come in packs of 20, so patients can easily track how many packs they smoke per day. But vapes come in various cartridge sizes with various levels of nicotine and can last anywhere from days to months, depending on use. So it may be difficult to track consumption. Plus, vape pens are manufactured to look like trendy digital accessories, which may make them more enticing, especially to teens or young adults. So now, let's jump into treatments. There are currently no FDA-approved meds for vaping cessation. So for now, we'll want to stick to proven smoking cessation strategies. Lean towards trying varenicline first. We know this is used to help people quit traditional cigarettes. But initial studies show promise for quitting e-cigs in adults and adolescents as well. Varenicline works by blocking nicotine binding to nicotinic receptors, and also partially stimulates nicotinic receptors, which lessens pleasure from nicotine and reduces cravings. As far as dosing, varenicline should be titrated over the first week. Most patients beginning varenicline for smoking or vaping cessation will get a starter month pack. They'll do 0.5 milligrams once a day on days 1 through 3, then 0.5 milligrams twice a day on days 4 through 7. Then they'll start on 1 milligram twice a day from day 8 and continue. Maintenance doses cost about $300 per month for cash-paying patients, but varenicline is often covered by insurance. We want to make sure patients get counseling about potential side effects of varenicline, including vivid dreams, insomnia, or headache. And keep in mind, varenicline labeling no longer has a black box warning about psychiatric events based on results of a large trial. Next, we'll talk about nicotine replacement therapy. This can be tried second line for vaping cessation if patients can't tolerate or are unresponsive to varenicline. We want to lean towards using combo nicotine replacement therapy, such as a patch plus gum. This way, the long-acting patch can provide constant nicotine levels, while the short-acting gum or lozenge can help reduce breakthrough cravings. Costs of these products vary, but keep in mind, some insurances will cover nicotine replacement therapy products. If patients do not have a prescription, help them find these products on OTC shelves. We can help patients figure out which patch dose to start on by figuring out what and how much they vape. Once we know this, we'll first want to check the e-cigs package or website to estimate nicotine content. So for example, Juul 5% contains about 40 milligrams nicotine per pod, which is similar to smoking a pack of cigarettes. For an adult vaping more than half a pod or 20 milligrams of nicotine per day, we can consider a 21 milligram per day patch as a reasonable starting point, or a 14 milligram per day patch if they vape less than this. And then bupropion SR can be considered for vaping cessation in patients who also have coexisting depression. It works by blocking reuptake of dopamine and or norepinephrine, which seems to relieve nicotine withdrawal symptoms and cravings. Dosing for bupropion is also titrated up. So patients will start with 150 milligrams once per day in the morning for the first 3 days. Then take 150 milligrams twice daily after that. Bupropion costs less than $30 per month for cash-paying patients, but is usually covered by insurance. A couple things we want to watch for with bupropion is that it can cause insomnia or agitation. If patients complain of insomnia, we can tell them to take their second dose earlier, such as in the afternoon, at least 8 hours after their morning dose. We also want to double-check patient profiles for any seizure meds, since bupropion is contraindicated in patients with a seizure history. Next, I want to briefly mention nicotine pouches, which can be tucked between the gum and lip and contain a powder made of nicotine flavorings and other ingredients. Common brands include Rogue, Velo, and Zyn. Patients may ask about these due to FDA's recent authorization of Zyn pouches. But we want to reinforce that although this may be the case, none of these pouches are approved as safe, and they should not be used as nicotine replacement therapy products. Lastly, let's go over a few practical common tips you can use in the pharmacy. Much like quitting smoking, helping patients quit vaping starts with a conversation. So consider the Ask, Advise, Refer model as an easy and efficient way to identify patients who vape. This can help you provide counseling and refer patients to additional resources if necessary. We want to ask our patients if they vape, advise them to stop, and refer them to services or other tools that can help. And we can develop a simple script to help guide these conversations. For example, if patients report vaping, follow up with strong, clear advice to quit, such as saying, As your pharmacist, I want you to know that quitting vaping or other tobacco products now is the best way to improve your health. And then connect the dots to next steps. You might say, there are many effective treatments to help you quit, and I can help you identify the best one for you today. You can also suggest free services, such as calling 1-800-QUIT-NOW. This connects patients with a trained quit coach who can develop a personalized plan for them and give practical tips such as how to deal with cravings and withdrawal. Or patients can text QUIT to 47848 to use smoke-free text. Patients who do this will get daily text messages to support them in their quit attempt. It also provides 24/7 access to advice, encouragement, and tips to becoming smoke or vape free. Some of these resources can even be specifically tailored towards teens who vape. And then the most effective option is in-person behavioral support and counseling with specialists. But we know this may not always be practical. To help, many pharmacies now also have smoking cessation programs that people who vape can also participate in. For more resources, check out our e-cigarettes and vaping chart, which gives more info about the uses and risks of e-cigs, along with our smoking cessation drug therapy chart that has dosing information, pros and cons, and patient counseling points. And if you want to go even deeper into this topic, check out the latest January episode of our other podcast, Medication Talk, Smoking and Vaping Cessation. In that discussion, a panel of experts explores advanced strategies, combination therapies, and real-world challenges in helping patients quit nicotine products. It's a longer, in-depth conversation packed with clinical pearls and nuanced insights that build on what we covered here. Perfect for anyone looking to expand their knowledge beyond the quick overview we talked about in this Clinical Capsules episode.
Thanks for listening. We hope today's episode gave you practical insights you can use right away. Now that you've listened, pharmacists and pharmacy technicians can receive CE credit. Just log into your pharmacist letter or pharmacy technician's letter account and look for the title of this podcast in the list of available CE courses. We've linked the resources we mentioned and more on today's topic right in the show notes. Those links will take you straight to our websites where you'll find even more concise, evidence-based charts, articles, and tools. If you're not yet a subscriber, now's the time. Sign up today to stay ahead with trusted, unbiased insights and continuing education. Listeners save 10% on a new or upgraded subscription. Just use code CC1026 at checkout. Looking for more? Check out our other TRC podcasts like Medication Talk and Rumor vs. Truth, or dive deeper with our full Pharmacy Essential Updates webinar series. If you found this episode helpful, follow Clinical Capsules and leave a quick rating or review. It helps others discover the show. Better yet, share what you learned with a friend or colleague and let them know they can find the show on any podcast app. Have a question or a topic suggestion? Reach out using the Send Us a Text link in the show notes or email contact@trchealthcare.com. Your perspective matters. Share your thoughts anytime to help shape future episodes. Thanks for listening. Stay sharp, stay current, and join us next time on Clinical Capsules.